So I'm an associate professor at the University of Auckland, and my area of expertise is vaccines and vaccination. And so to get into that, my background was in biological science and then molecular medicine, and then somehow I ended up in public health. And then I realised there were lots of questions that could do with better answers. So that's what drove my research interests, which is around generally around vaccine effectiveness and vaccine safety. So I've been doing that for about 27 years. So meningitis is something that happens when there's an inflammation around the tissues around your brain and around your spinal cord. So it can be caused by lots of different things. So not just sort of meningococcal bacteria and things like that. It can be caused by viruses and a whole range of bacteria and other things as well. So it's really something that has lots of agents that cause it. So it's not a disease in its own right. So in New Zealand, we've had some really big causes of meningitis and also the infection in the blood, septicemia. And those have sort of changed over time. So quite a few years ago, like maybe around 30 years ago, the main cause was something called Haemophilus influenza type B, which is a bacteria. It's nothing to do with the flu. And then there was a vaccine that was introduced and it pretty much got rid of it. And then we had a huge meningococcal epidemic, which was at the time a big cause, a major cause of meningitis. And then after that waned, the biggest cause was pneumococcal disease. And then a vaccine was introduced for that. So these have been primarily the big causes that we've been able to address with vaccines. The people that have the greatest risk, anyone's at risk, right? Anyone can get these diseases, but the people that are most at risk of meningococcal disease are people in certain age groups, particularly the very youngest, infants under a year or two of age, and then children under 5, followed by people who are in their adolescence and early adulthood, and then older people. But also across all age groups, there's people who've got problems with their immune system. So they're another important group as well. And also people living in crowded conditions and other places where you're perhaps more at risk for coming in contact with the bug. So with meningitis, some of the lasting effects can be neurological deficits, problems with memory, exhaustion. Also deficits to hearing. People can lose their hearing as a result of having meningitis. And people who have septicemia or the blood poisoning can be left with significant scarring, and also that's what can result in limb amputations. At the moment, the vaccine available covers 13 different types of pneumococcal disease. So that's most of the disease, but not all of it. And one of the challenges with pneumococcal disease is as we get rid of some types through the vaccines, some other types can creep in and start causing a problem. So we keep having to move to cover off those. So in the future, in the very near future, we're going to have some newer ones that cover more types. So that's what's available at the moment here. But there's also another one that can be given to older children and through adulthood, and that covers 23 types. But it's the immunity that it gives is not really as good or long lasting as the other type of vaccine that covers the 13 types. But in people who are very high at risk, you can use both vaccines. The vaccines that we have available today for meningococcal disease cover most of the disease, which is great, but you do need to think about having 2 different vaccines. So there's a vaccine that covers group A, C, W and Y, so 4. And there's another vaccine that covers group B and quite a bit of some of the other types as well, but it's targeting B. And as a bonus, it also gives some protection against gonorrhea. So if a person was choosing to have one of the vaccines, the group B vaccine would be the best, because most of the disease in New Zealand is caused by group B. Followed by some of the others. So that would be the first choice, and that's offered in the infant program and also to young people living in hostels and things like that. I guess if you're looking to purchase these vaccines, if you're not eligible to get them for free, there are two different ones, and for the best coverage, you would get both. But if you had to choose between one, the Group B one will cover more disease in New Zealand at the moment than the other one. So these vaccines differ in how effective or in how efficacious they are. Where you've got a disease that's really rare, like meningococcal disease, horrific but fortunately quite rare, and you get vaccines that are perhaps they're like 70, 80, 85% protective. But once you start using them, what you find is that they stop the carriage of the organism, and that starts to disappear from the community. So you actually end up removing that that particular disease from the community, which is what we've seen with a number of these vaccines. So it's actually quite complicated. So there's both the protection to the individual, which is not 100%, like any vaccine, it's not 100%, but there's also the wider community effect as well. I think when it comes to meningococcal disease, I think ideally, in my ideal world, that it would be available to not just infants, but also available coming into adolescence, and perhaps again at the end of adolescence, to, I guess, cover the periods of life when the risk is the highest. There's a range of vaccines that protect against meningitis, different types of meningitis, and septicemia. None of them will keep you protected for your life, but they induce a long-term memory. So you have the memory there, and you can go and give it a boost. But diseases like meningococcal disease move so fast. You hear the stories about somebody being well in the morning and very sick by evening. That's not enough time for the memory to that disease to kick in and produce the antibodies and things and those other goodies that you need. That takes a few days. So you need to have a good presence of antibody ready to go. And that's why to maintain that protection, you need to get boosters. But generally, I would be thinking you'd want to look at sort of 5 yearly if you needed to maintain that protection. Some of them perhaps give you protection more like 10 years, but as an individual you don't know, and we all do differ a little bit. So I think it's really about thinking when those highest risk periods of life are. When infants are born, by and large they receive protection for the first months of life from their mum, so they've received that through the placenta before they're born. Those antibodies don't last, so you start to see that risk go up after the age of 6 months, and then they start getting exposed, carrying the bug, making their own protection, etc. Unfortunately, it's the times when our own barriers fail us that the bug is able to cross into the bloodstream and cause havoc in a situation where the body's immune system just isn't able to get on top of it in time. And some people have a deficiency, which means they have more difficulty getting rid of the bugs. So with the pneumococcal vaccines and the meningococcal vaccines, they have excellent safety profiles, and I don't think there are any serious adverse events that are more likely to happen in someone who's got a vaccine compared to someone who hasn't. There's always a risk of anaphylaxis, of course, that goes with any vaccine. But the Bexsero vaccine is associated with a decent sort of fevers, and so this is the reason why when infants are receiving their Bexsero vaccine that they also offered paracetamol just to manage fevers. So I think that's probably the most common event that's associated with these vaccines. I think what's really important for people to know is that meningitis and septicemia are caused by many different organisms, and a vaccine that protects you against one type isn't going to protect you against another. So to be aware of that, and also that the protection isn't necessarily lifelong, so to always remain vigilant.